question, a child presents with non-hemorrhagic bullous lesions on areas of mechanical friction. So I will try to highlight what are all the important clues which are actually mentioned in this question. So if you look at the clues, so there are bullous lesions and the age of the patient, you can see it is a child. And where are those bullous lesions developing? It is over the areas wherever there is mechanical friction, and it is healing without any scarring, So Nikolsky sign is done and it is negative. Nikolsky sign is negative. So you need to choose the correctly matched defective protein and its site involved in this condition. So with all these clues, if you have diagnosed this case to be a case of epidermolysis bullosa, then your diagnosis is correct. Why? Because at the mechanical friction areas there are bullous lesions developing, so it comes under the vesicular bullous disorders group, and that too specifically it is mechanobullous disorder. So it should be some kind of a mechanobullous disorder. So that is first thing. And you can see one more clue is given, without any scarring. So the healing is happening without any scarring. So this should be an entity which is an example of a mechanobullous disorder, which are all genetically acquired conditions. And in the epidermolysis bullosa we have simplex, junctionale and dystrophica. And if you observe among these three, epidermolysis bullosa simplex is the mechanobullous disorder which is having intraepidermal split. The split is going to be intraepidermal in the case of epidermolysis bullosa simplex. So the healing will take place without any scarring. Okay. So the diagnosis here in this case is epidermolysis bullosa simplex. I hope everything is clear till this point. And after this, the only thing which you should know is dependent upon the memory. So among the given options, you can see that K5 and K14 are the protein, and stratum basale is the site where there is genetic defect of keratin 5 and 14. So the answer is option A. So let us see, almost all the students have marked the right answer for this question, and I am very happy for this. So basically, I hope all of you do remember that in the epidermis, keratinocytes are the majority of the cells, forming 85 to 90% of the cell population, whereas the rest of the cells are Langerhans cells, melanocytes and Merkel cells. And in the keratinocytes also, the hallmark protein is, of course, it is keratin. Keratin is also called as stonofilaments or intermediate filaments. So these keratin filaments, they are going to decide what is going to be the consistency of the particular structure. Like for example, in the skin, the keratin, it is going to be present with few of the disulfide bonds. Okay, so these keratin, you should also remember that it will be present in the skin, hair and nails in the form of heterodimers. What does heterodimers mean? So there will be a combination, or that is, there will be a coupling, and these couples, so these couple of the proteins are going to be different types of the protein. So that's the reason why it is heterodimers. So the couples are going to be different. So what does this mean? So basically, the keratin filaments, they are of two types. First one are the acidic type of keratin, and the second one are basic type of keratin, and these two are going to form a couple. Like for example, as you can see, it is K1 and K10, which will be both coupled together to form the heterodimer, and these combinations are present precisely in different anatomical locations. Like for example, in the epidermis, stratum spinosum is going to have a combination of keratin 1 and keratin 10, and in the basal layer, stratum basal, the combination is of K5 and K14, keratin 5 and keratin 14. So these are the two things which you must remember. And not only that, depending upon the disulfide bonds, you should remember that the hardness of the structure is going to differ. Like for example, in the skin, the number of disulfide bonds is very few. That is the reason why skin is very soft. Whereas the nails, they are also having the same protein keratin, but here the disulfide bonds are more in number. That is the reason why nails are very hard to touch. And these are some of the structures in which the heterodimers of the keratin are present in these combinations. So we have already seen stratum basal, it is having a combination of keratin 5 and keratin 14, keratin 5 and keratin 14. As you can see, the stratum spinosum layer, that is the just suprabasal layer, is having a combination of keratin 1 and keratin 10. And in the next layer, that is stratum granulosum, the combination is keratin 2 and 11. And the next one which you should remember is in the eye cornea, it has a combination of keratin 3 and keratin 12. And yes, in the nails we have keratin 6 and 16 as the combination, whereas in the liver the combination is keratin 8 and 18. So these are some of the important ones, and I will try to mark the most important ones with the star. As you can see, keratin 5 and 14 is the heterodimer which is present in stratum basal, and this is genetically defective. This protein is genetically defective in epidermolysis bullosa simplex, which is a mechanobullous disorder. So that